Acoustic neuroma is also known as scythe nerve tumor. This is one benign tumor. Develops slowly, usually starting in the 8th cranial nerve of the brain. Nervevestibule acoustic neuromas can affect one or both ears. Usually one side. Are about the size of a fingertip or a chicken egg but are located in the posterior fossa of the skull, so they can cause many serious disorders. Acoustic neuromas account for about 8% of all brain tumors. The age group most commonly affected is 30 to 60 years old. To date, the cause of acoustic neuromas has not been clearly identified. The factor that increases the risk of developing the disease is due to parents carrying a type 2 neurogenic gene disorder passed on to their children. Acoustic neuroma progresses slowly, and in the early stages, symptoms are often vague, making it difficult for patients to detect the disease early. Symptoms also depend on the size, location, and spread of the tumor. Some typical symptoms of the disease in the early stages include hearing loss. Progresses slowly. Can take months to decades. Usually within 2 years, patients may have sudden or transient hearing loss. Tinnitus. Hearing a ringing or hissing sound in the ears. Loss of balance. Vestibular syndrome. Central type, nystagmus. Symptoms in later stages, when the tumor spreads into the posterior fossa and causes paralysis of some cranial nerves. Fifth nerve palsy. Loss of corneal reflex. Decreased skin sensation on the side of the face with the tumor. Later paralysis of the masticatory muscles. Sixth nerve palsy. The eye on the side with the tumor is turned inward, with intermittent headaches or sometimes headache excruciating. Facial nerve palsy. Mild hemifacial paralysis or facial muscle spasm on the side with the tumor. When the tumor spreads to the cerebellar angle and brainstem, the limbs are disturbed. Walking is unsteady. Hands and feet tremble. Walking or falling towards the side with the tumor. Symptom: increased intracranial pressure. Severe headache in the top of the head and neck. Vomiting. Symptoms of the disease will gradually increase, possibly leading to progressive coma or cerebellar tonsil herniation, causing death. Early diagnosis of acoustic neuroma is a decisive factor in preventing unpredictable complications of the disease. Methods of diagnosis include: diagnosis is based on clinical symptoms of the disease. Neurological examination and hearing test with audiogram. Conventional skull scan, magnetic resonance imaging or brain CT scan. Treatment options include surgery, radiotherapy, and monitor the patient's condition. The choice of treatment will depend on the size, growth rate of the tumor, the degree of organ dysfunction, the patient's age, lifestyle, and the risks of complications from surgery. Details of the treatment methods are as follows. Surgery. This is the most reliable treatment method, especially in cases where the tumor is detected when it is still small, and can restore the patient's hearing and the function of the surrounding organs. In addition, instead of traditional surgery, doctors can perform gamma knife surgery to treat acoustic neuroma for patients. This method uses high-energy gamma radiation rays aimed at the tumor, without affecting the surrounding area. Radiosurgery has the advantage of being non-invasive and having few complications, especially for small tumors or tumors located in difficult surgical locations. For large tumors that are difficult to completely remove, the doctor can combine partial surgery with residual radiosurgery. Radiotherapy. This method helps reduce the size or limit the growth of acoustic neuroma. This method is preferred for elderly patients, those in poor health, Those with tumors affecting both ears or tumors affecting the only ear that still has the ability to hear. Monitor. In cases where surgery or radiation therapy is not possible, the doctor will order monitoring of tumor growth and periodic brain MRI scans to evaluate the tumor. Notes during and after acoustic neuroma treatment. Be aware of possible complications of surgery because part of the nerve that controls hearing, balance, or the facial nerve may be removed. These complications can include hearing loss, balance disorders, facial paralysis, etc. Return for follow-up appointments to be checked, monitored and treated to limit disease progression. Follow your doctor's instructions exactly. Do not take medication without a prescription or stop taking medication on your own. If acoustic neuroma is allowed to grow large without timely diagnosis and treatment, it can obstruct circulation cerebrospinal fluid, even causing death. Therefore, as soon as there are warning symptoms of the disease, the patient should go to the doctor for a definitive diagnosis and early treatment plan.